Hi, everybody. This is the RMIREX Short Takes on Suicide Prevention podcast. I'm Adam Hoffberg, and today we will be talking with Richard Egan from the Nevada Department of Public and Behavioral Health with the Department of Health and Human Services, where he works as both a suicide prevention trainer and outreach facilitator. Today's episode is sort of our second installment in our series that talks about firearms and suicide prevention. We're always excited to hear what's going on in other states and programs around the nation. So thanks for joining us, Rick.
Oh, no problem, Adam. I'm glad to be here.
To get a little introduction on yourself, I understand you spent over 26 years in the United States Air Force, and 10 of which you were directly working in suicide prevention and intervention efforts. Hoping you could share us a little bit more about your background and how it led to your current position in Nevada.
Oh, yeah, that's definitely not a problem. So when I started my Air Force career, I started as a munitions specialist dealing with explosives, bombs, and bullets, and that's what I did for many, many years. But as I went through the ranks, what we do is start taking care of people and getting the mission done with making sure that our people have the resources that they need. So as you go up into the ranks, your job titles kind of broaden, even though you're still dealing with bombs and bullets, as an example. We're dealing more with people and developing people and helping them through whatever life issues they may be going through. And towards the higher end of my career in the Air Force, I was a first sergeant for a little while, and one of the primary jobs of a first sergeant is taking care of the people. They don't take care of making things happen in the mission. It's more taking care of the people so that the mission can be accomplished as a first sergeant. And during my tenure as a first sergeant, we did intervene with individuals with thoughts of suicide and being able to connect them to resources. As I came back to the United States, that role continued. What I understood that the way to protect our airmen from suicidal acts is to actually be connected with them and be able to connect them to resources earlier in their thoughts of suicide or earlier in their life crises so it doesn't get to that point. But because of the stigma and taboo about mental health and things that are going on not only in the Air Force but in our communities, prevents individuals from reaching out to the mental health community to help them with their life crises that might be going on. And so towards the end of my career in the Air Force, I became a foster parent, and I was a foster parent for 7.5 years and about 63 children, mostly teenagers. So when I retired from the Air Force, I started to work for the Department of Family Services. I worked for the Department of Family Services for 2 years teaching foster parents. And as I was doing that job, the state of Nevada was requesting a training facilitator for suicide prevention. That's when I applied for it, and I got picked up for it about 3.5 years ago, and it's been an amazing adventure ever since that moment. To be able to take my care of people and put that into action. Yeah, I don't deal with bombs and bullets anymore, but in what we're going to talk about today, access to lethal means, that has a huge angle on suicide prevention that most people may not be able to do, may not be able to talk about, because when we talk about access to lethal means and firearms, we have the Second Amendment we have to consider, we have the safety and security of the firearms that we have to consider, and ultimately we have to have that conversation with all of those things in mind, because if we don't have the Second Amendment in mind when we have the conversation is not going to go very far. And that's where my background in suicide prevention helps me guide the state of Nevada in access to lethal means when it comes to firearms.
Thank you for that introduction. Yes, and it's a great history and rich story you have coming through the Air Force and then applying your skills to Nevada. We want to know a little bit more about Nevada. We have listeners from various parts of the country who may not know as much. Could you tell us more about the suicide issue in your state and any unique features in Nevada that you can point out for us?
Of course. So when we look at suicides in Nevada over history, 1999 and prior, Nevada was hands down the highest suicide rate across the nation. No other state could touch us. And so between 1999 and 2010, we fluctuated between number 1 and number 5. In 2011, we moved to number 6. In 2012, we moved to number 7. In 2013, we moved back to number 6. And in 2014, we stayed at number 6 in the crude rate for suicide. But in the age-adjusted rate, we actually moved to number 8. So slowly but surely, we are moving away from number 1. Now, in the elderly suicide rate, the 65 and above, we have always been number 1, and we are still number 1. There was 1 year that we moved to number 2, and that was 2013. And so we have had a long history of being in the top 5 for all of the nation's suicide rates amongst the state. And when we saw the report come out for the nation in the spring, this past spring, we saw that our nation had gone up between 1999 and 2014, 24% in the suicide rate. But when we looked at Nevada, Nevada actually moved down a half a point in that same time frame. Now, that's not a lot, but when you look at 24% across the nation, and we're the only state that reduced in the suicide rate in that same time frame, not only did we stay level, we actually reduced a small amount. And it's not just one thing. It's multiple things that are going on in our state that helps to reduce our suicide rate, to help individuals with thoughts of suicide get connected to resources sooner in their life crisis, sooner in their thoughts of suicide before it becomes a suicide action.
Thank you. And, I just want to reiterate that because that really does seem like a powerful and certainly is impacted by your great work going on in the state, that your state was the only state during this time period that actually saw a reduction in suicide rates while the rest of the nation was experiencing upwards of 24% increase in their suicide rates over that same time frame.
Yes. And so even though it was just a small amount, we are taking the lead in some of these avenues, such as access to lethal means, which includes medications and firearms.
Great. So let's talk a little bit more about this idea of access to lethal means and specifically firearms for today. But as you mentioned, there's other lethal means and other sort of means safety ideas. But for today, we are going to focus on firearms. And I did want to get a sense of how big is the firearm suicide issue in Nevada?
In Nevada, historically, if you look at a 10-year chunk, we have suicides at 57% of Nevada suicides are completed with a firearm. Compared to the nation, which is 51% currently in 2014, and Nevada's suicide rate with firearms is currently 2014 numbers 54%. And so even though historically we were at 57%, we've actually come down in 2014 to 54%. And so, again, many things equate to that access to lethal means. When we talk about access to lethal means, it's not about the Second Amendment. It's about where that firearm is when the owner does not have possession of it. When the owner does not have it on their hip or in their hand, where is it located? Is it accessible to somebody else? As a gun owner myself, I ensure that my firearms are not accessible to anybody but me. They're mine. And so that responsibility to me belongs with me. And that's what we try to talk to other gun owners about and give them ideas about how to secure the firearms. We know that we want long storage of firearms in a safe, separated from the ammunition in 2 different locked up containers. Now, when we're talking about home protection or personal protection, that's not feasible. And so we look at other means to secure a firearm when it is designed or implemented for home security or personal security. And so there's security boxes out there. There's ways to secure the firearm when it's not one of those. And believe me, if a person has the authorization and does carry it, we're not going to have a lock emblem on it. What's going to happen there, it's on their person, and on their person is secured. But when it leaves their person, where does it get put? And that's what we try to get our community members to think about. Where's it at when it's not in your possession? Who has access to it when it's not in your hand? When we're talking about these ways to secure them. Understand that a person that purchases a rifle may not always have a large safe that it can go into right away. So we encourage many other types of security devices. And these security devices that we encourage, many of them are specifically designed for certain firearms to ensure their security at the utmost ability of that securing device. That will help prevent somebody from gaining access to its use when we don't want them to.
Yeah, that's really helpful. And I noticed you sent ahead some materials, and I saw that one of your brochures was actually specifically about all the different storage options and the pros and cons of each. And you sort of already touched on some of that, but any particular storage option that you want to highlight that our listeners may be interested in?
Doing this work I do and looking at the different security measures for firearms, one of the biggest things that I can always encourage is that if you use a securing device that has a key, make sure that the keys are secured behind a combination lock. The best thing to do is always have a combination lock, but some of the securing devices can't be designed with a combination lock, and so they have to have a key, but ensure that that key is locked up, that nobody has access to that key, because I've seen it time and time again that the securing device is in place on the firearm, but the key to it was accessible by somebody that shouldn't have access to it.
And why does this all matter for suicide prevention?
It all matters for suicide prevention because if you look at all the possible actions for suicide by firearm, there's no time to intervene. Every other possible method, there is more time to intervene. But when you have that triggering event in a person's life that drives them to acting upon their thoughts of suicide, there is no time to intervene when access to a firearm is available as their means. When we go back and we look at suicide attempts, the triggering event for 22% of the individuals who attempted, their triggering event was within 5 minutes prior. And so the triggering event for action of suicide being within 5 minutes, and if their plan is a firearm and they have access to a firearm, there's no time to intervene. Every other method of suicide, there is more time to act to help prevent that suicide from occurring.
Thank you. That's extremely well said. And I think that point is so important to drive home when people are thinking about suicide prevention and how we can make a bigger impact, and understanding that this access, just easy access to lethal means, prevents us from having that time or space to overcome ambivalence or reach out for support or, call a crisis service. So that's why we're talking about safe storage today, is because that can increase that time.
Absolutely. That time is crucial. Individuals are suicidal for a short amount of time. It's different for every person, but the suicidal individual will not continue to be suicidal as long as he has time and resources to help him with those thoughts.
So we understand now the importance of lethal means safety and getting the word out about safe storage options. So how do you actually go about doing that in Nevada?
In Nevada, when we talk about gun safety and security and safe storage, the Office of Suicide Prevention, along with the Nevada Coalition for Suicide Prevention, which is our nonprofit individuals that help us do what we do, we go directly to gun shows across this whole state, and we talk directly to the gun owners. And what we want to do is start to spread that conversation amongst gun owners. And so part of what we're doing in the state of Nevada, we actually reach out to gun shop and shooting ranges. gun shops and shooting ranges across this whole state. We invite the employees to come and take Safe Talk, suicide alertness for everyone. And we encourage the managers and owners of these gun shops and shooting ranges to come and take the ASSIST, Applied Suicide Intervention Skills Training, because sometimes an individual will go to a gun shop or shooting range to find a way to take their life. And they'll give off clues, they'll give off hints that it might be about suicide. So we talk to the employees and we teach them how to listen to some of those things and check it out, find out if it is about suicide. And if it is, then we connect them to resources. And the first resource that an employee is going to connect them to is the gun shop owner or manager that is Applied Suicide Intervention Skilled Trained, meaning that they can intervene with the person with thoughts of suicide and connect them to resources within the community that can help that person with thoughts of suicide. Can you imagine going to a gun shop or shooting range to find a way to end your life, and instead of ending your life, you get help? You get connected to resources in the community to help you with those thoughts of suicide. Most people don't want to die. That will to live is there, and that's why those hints come out, those clues that it's about suicide. Before this training was occurring, if an individual that was acting strangely came into the store, they would be shunned out of the store and not connected to resources. And that may have been their only hope for somebody to intervene with their thoughts of suicide. But not only do we give the training for the employees and the customers, but understand this, we get most people into the trainings for their profession, but chances are what they're going to do with their training is help a family or friend first, because we know individuals with thoughts of suicide historically will tell or hint to a family or friend first. And so the very first class that we had 3 gun store managers in, one of those managers intervened with an employee with thoughts of suicide 72 hours after the class. So he graduated from the class on Friday. Monday morning, one of his employees didn't show for work. And so he called the employee. The employee was giving the manager hints that he was having thoughts of suicide, and there were firearms in the home. That manager intervened with that gun shop employee that Monday morning and connected him to resources to help him with his thoughts of suicide. And so as we start to build the infrastructure in the state of Nevada around access to lethal means with some of these training programs, that's where the continuity starts to build. We don't give the gun shops or shooting ranges any other different training than what a professional will get or somebody working with veterans would get. That continuity is there. Granted, in the classroom, when we have a gun shop shooting range class, yes, the conversations are around gun shops and shooting ranges and some of the things that individuals will say or do in that environment that indicate they're having thoughts of suicide. But the basic core information is the same, whether there's a gun shop employee in the room or a social worker in the room. We're building that continuity across this whole state. If you get a training here in Las Vegas, it's the exact same core information that you'll get up in Reno.
That's great. And just the idea that you're training these employees who are right there, right in the middle of things, and just able to pick up on the warning signs and then act and connect people to resources. That sounds like a great model.
It is. It's awesome because that's what we're teaching them, is how to connect them to the appropriate resource. And that's where the intervention skills trained individual comes in. They go to a 2-day course which certifies them into being able to intervene, assess that risk with a person with thoughts of suicide, and connect them to resources through their safe plan, where the person with thoughts of suicide builds their own safe plan with the interventionist. And those are just a couple of the programs that we have across the state of Nevada. We start with social emotional learning for elementary. It's not suicide prevention, but what it is it's helping the individual in the elementary school deal with life issues, social emotional learning. When we move to middle school and high school, we have across the state available SOS, Signs of Suicide. That is an educational and screening program for middle and high school students. And as we go up, we have Suicide Talk. Suicide Talk is a program where we get the fire burning in somebody's belly that they can do something about suicides around our community. It's the awareness piece. It's breaking down the taboo and stigma around suicide, kind of like a suicide prevention walk that we have every year in Henderson and across 12 other communities in Nevada. And it's growing and growing every year. That breaks down some of that taboo and stigma. We have a couple walks a year. We have one for the Nevada Coalition for Suicide Prevention every September. The National Organization for Suicide Prevention has their walk every March. And what we do is we make sure that that suicide prevention walk in Las Vegas is 2 parts of the year and 2 parts of the city, and being able to break down that taboo and stigma. As we go forward, then we have that suicide alertness. We have that alertness that suicide may be present. Then the intervention skills, that intervention person, that person that assess the risks of suicide and helps them build a safe plan. We have coming to Nevada Suicide to Hope. Suicide to Hope is a curriculum for clinicians that help individuals that have attempted suicide. Those individuals that have attempted suicide, they need that professional help. And we have a course for those clinicians to help them help the person that has previously attempted suicide. Not only that, we also encourage youth mental health first aid and adult mental health first aid. These are 2 additional programs that the youth mental health first aid we have in place, and we're going to get adult mental health first aid in place. These are all trainings around suicide and mental health that educate our individuals out in the community that they can do something about this. These programs that we provide across the state of Nevada are all vested trainings. Some of the trainings are vested over 30 years and are worldwide, but at least all of our trainings are at the minimum evidence-based national trainings. Even our youth mental health first aid, it started in Australia, was modified for the states, and is a national program here in the United States. Even though it was born in Australia, we utilize it here nationally. And that goes hand in hand with the adult mental health first aid. 2 different versions, one's for youth, one's for adults. But we cover those common mental health concerns with those age groups, and we educate our communities to be mental health first aiders.
Yeah, it sounds like you have quite a spectrum of programs, all the way from this upstream approaches with children to really clinical training for providers. And I think, as you mentioned, we sort of need it all. We need it to fill all these different gaps along the spectrum, from children to adults and from gatekeepers to clinicians.
Oh, absolutely. And when we look at what's going on, yes, we get a little bit of grant funding here or there to help one of the programs move forward, but we don't put all of our eggs in one basket. We make sure that we are continually going down each one of these avenues. And so when we look at suicide, we know it's a life cycle issue, meaning individuals that are youth can have thoughts of suicide, individuals that are young adults can have thoughts of suicide, our middle age can have thoughts of suicide, and our elderly can have thoughts of suicide. And in the state of Nevada, when we look at those different age groups, we make sure that we are addressing each and every one of them. Each and every one of those different age groups can have a little bit different group of life crises that could lead to suicide. And so we want to make sure that we're addressing them all. So for instance, our military and veterans, we want to reach out to our military and veterans around suicide. We want to reach out to our youth. Our youth suicides are so impactful in our community that we lose one youth to suicide, that could be 100 to 200 attempts amongst our youth. And we want to make sure that any youth who's having thoughts of suicide gets connected to those resources. Our young adults that are initially trying to reach out into their life and be able to progress in education and their job field and these things, those life issues could be stressful to them, and we want to make sure that we reach out to those individuals. How about our middle-aged individuals, our individuals that are our workforce? They could be losing a job or be having a gambling addiction or substance use addiction or loss of a spouse or divorce, any of these things that could be affecting our middle age, we want to address and let them know that we are here to help them with their life crises. When it comes to our elderly, in our community here in Las Vegas, we have 75% of our individuals that are here, our residents, came from someplace else. One of the most resilient factors for suicide is connectiveness to neighborhoods, church, family, communities. And so if 75% of our community members came from someplace else, where did they leave their connections? Someplace else. And so making sure for our elderly that we reach out to them and show them that there is things that they can be involved in, that there are things that can help them be connected to their community. That connectedness can be a resiliency factor to suicide. But ultimately, it can be a resiliency factor to feeling depressed. It can be a resiliency factor to feeling lonely. It can be a resiliency factor to feeling like a burden when they have things that they're connected to. And so although connectiveness is a lifespan issue, it's really important with our elderly 65 and above.
Yeah, and as you mentioned, this idea of connectedness is so important, and I think it's a nice segue to this idea that there is a community of gun owners, and you already sort of touched on this, that you're going out to gun range owners and other folks who own guns and really having the support come from within. Could you talk a little bit more about that?
That support that comes within, understand, like I mentioned, individuals with thoughts of suicide, they are going to reach out to family or friends first. And so when we have these conversations with our community members about access to lethal means, it starts this conversation that I, as a gun owner, are connected to you, meaning that I have an understanding of that community group, that we can be connected. And so in the gun shows, we actually give away high quality locks for the guns that are out there. And we raffle off a gun safe every gun show we go to so that we can start those conversations. And it's so amazing when we start those conversations with gun owners that immediately they find out it's not about the Second Amendment, it's about gun safety and security. Where is the firearm when it's not in your hand? Who has access to it when it's not on your side? And so when we start the conversation that way, they get it. And then when we hand them these gun locks that are high quality, there's one catch to that. That one catch is, I want you to talk to 2 other gun owners. I want you to talk to 2 other family members that own guns and talk to them about the same thing we talked about. Where are their firearms? Who has access to them when they're not in the possession of the owner? And it's so amazing that when we have that conversation, it's like they get it. They said, I got it, and thank you for the lock, and I'm going to go talk to 2 other people. Because when we get our own community members being part of the answer, that's when we make a huge difference. When we get the people in the room to be part of the fix, because we as a community can help make a difference. It's not one person. It's not one road we're going down. It's not one program. It's working because it's all of it together. And understand, prior to 2013, this conversation about access to lethal means and firearms was not happening. That access to lethal means conversation started in February of 2013. When my boss, Misty Allen, the suicide prevention coordinator for the state of Nevada, realized that I owned firearms, she asked me to look into this program and to help build a access to lethal means program here in Nevada. I reached out to New Hampshire. I reached out to some of the other states that were doing similar programs, and I took what they were doing and I addressed their challenges that they came across. And in that, we built the state's program for Nevada. And not only is it the outreach to the gun shops and shooting ranges, it's implementing the trainings, it's going to the gun shows. Ultimately, though, we're also moving in one more direction. We're moving in one more direction to access to lethal means with the professional. Being able to help educate the professional individuals that are helping individuals with thoughts of suicide have that access to lethal means conversation. Being able to talk to somebody about gun access in a home, or being able to encourage the proper security of a firearm or medications with the home. Because when we look at medications is the number one attempted method for suicide. And with that, if we could secure the extra medications, secure the medications from individuals that may use them to attempt to take their life, we could prevent that means of attempt or that means of a completed suicide just by securing it.
Right. And could you speak to a little bit more about how this idea of gun safety and gun security already fits within culture of owning a gun?
The culture of owning a gun, we've always talked about gun safety and security, but now what we're doing with Access to Lethal Means program across the state is we're getting the whole community to talk about it and to encourage it and promote it. Prior to this, it was just an understanding of gun owners that we had to secure weapons. But when we look at some of the suicides that have gone on across this state, the access to those firearms were prevalent in many of the suicide cases. And that brings us to that other aspect. We actually have a team here in the state of Nevada that looks at suicides. And that team of individuals looks at suicides to be able to steer what the state of Nevada does. And our report goes to the Department of Health and Human Services Director, and that report encourages what the state does as a whole. And those individuals, when they look at the firearm suicide, we look at where the firearm came from. And when we find out about the firearm and where it came from, could there have been a means to secure that firearm that would have prevented this suicide? And in many cases, that is true. And so we still have more work to do, because when it comes to suicides, those firearms need to be secured from those individuals that are going through a life crisis or mental health concerns or suicidal thoughts. And so when we have these conversations, we're reiterating what the gun owner was taught. The gun owner was taught to secure their firearms, but maybe because we don't talk about it very much, this conversation brings back some of those basic skills that they were taught and reminds them to make sure that their firearm in any situation is secured from somebody else utilizing it.
Absolutely. Could you tell us a little bit more about this committee that reviews suicides and, why this surveillance infrastructure is so important for suicide prevention?
Oh, sure. So Suicide Fatality Review Committee for the state of Nevada enacted a couple years ago. We have had several meetings. What we do is we meet face-to-face twice a year, and then we meet on the phone several times a year. And the face-to-face is the key. The face-to-face meetings are when we actually look at suicides across the state of Nevada. And when we look at suicides across the state of Nevada, we have a selection process. We look at suicides that occurred 2 years ago because we want to make sure the case is closed and everything's settled down. And so we select 20 to 25 cases from each year, and then when we get those cases, we go back to the coroner's office, we go back to the law enforcement agency that was involved. We try to collect as much data as possible about the case. So, for instance, if it's a military or veteran person and we can get data from the VA, we're working on that MOU right now with the VA so we can get their data and be able to look at it. But for instance, if it was an active duty military person, we'll reach out to that service or that service agency and ask them for any insight on the case. Once we collect as much data as possible on that case, then that case is presented to the committee. The committee reviews that case in depth, tries to glean information from that case to help steer the state of Nevada. So that data is then collected and put into a report to be sent to the director. The director reviews that case, that report, and as the report is reviewed, we look at ways to implement the recommendations. And so now we're in the mode of implementing several recommendations. For example, one of those recommendations is that we need to do a better job reaching out to our minority communities, reaching out to our Hispanic communities out there in the Nevada area, because the taboo and stigma amongst our Hispanic population is so ingrained that we need extra help there. We need some extra avenues to reach out to our minorities and our Hispanic communities to help that culture address suicides within their culture. And so that's one of our avenues as an example. We have multiple more. We had 12 total. And not going over all of them, but there was some financial infrastructure. There's reaching out to mortuaries and reaching out to families that have lost individuals to suicide because they become themselves at risk for suicide. Several of our cases that we reviewed, there was a prior family member suicide within their culture. And so that could have been one of those things that if we had reached out to the families in the process after a suicide, perhaps we could have connected them to resources that could have steered that suicide in a different direction.
Absolutely, and I'm glad you touched on that. There is, quite a bit of emerging evidence about, this idea that many people are affected by a suicide and can perhaps be at risk of suicide themselves. And so it's just important to remember that we got to make sure that we're reaching out to the families and the friends and the loved ones to make sure they have resources to help themselves after a situation like this.
The statistics is 6 people are affected by one suicide. That statistic's out there, but I don't know where we come up with that because I look at suicides, I investigate them, I read about them. I don't see it. Maybe 6 family members, but when you look at people affected by a suicide in our community, if we have a youth end their life and they belong to a school, that suicide just affected thousands in our community. If that suicide is reported on or talked about within the community, that could affect more. Now, when we look at that, is that a good thing or a bad thing? It depends on how we talk about it. We have national guidelines on how to talk about suicides, and we want to talk openly and directly about them because we don't want to encourage the stigma and taboo around suicides, but we have to have that proper way of talking about it that minimizes contagion when it comes to suicide, because I'm a firm believer we have more people affected by suicide than that statistic of 6. And we need to encourage reaching out to not just those 6, but anybody affected by that suicide.
So, Rick, I'm glad you mentioned that because some more recent reports from Julie Sorrell of the American Association of Suicidology has really pointed to that idea that many more people are affected than just 6. And actually, there's even a hashtag that she started, hashtag not 6, to really drive home the point that many people are affected and that we need to look at each suicide individually and reach out to the family and those affected for each particular situation rather than trying to use the statistics too literally.
Right. And statistics kind of give us a baseline. And so when we look at these, understand that for a long time it was 6 that were affected, and then it moved from 6 to 33 in another report somewhere in between there. And the report you're referring to talks about 115 people are affected, and 25 of those are affected deeply. And so when we look at the statistics, yes, take that into account. But when it comes to suicides, every one of them is different. The amount of people that are affected by every suicide is different. And so we want to make sure that anybody affected by that suicide is granted help or connection to resources within the community. So when we have that youth that ends their life, that could be thousands of people that are affected. We want to bring resources to those thousands of kids that could be affected by that suicide. We don't want to strap ourselves to a number. We want to look and be proactive to that one particular suicide so we can minimize that contagion and get the resources to those individuals that are affected by that particular suicide. And the only way to do that is to address each suicide in its entirety, to look at each suicide and make sure that we are reaching out to those community members that could be affected by that one suicide in our community.
Well, Rick, that's so great to hear about the work going on in Nevada and all the strides you all have made to really provide resources and help and support and just being there in the community to let people know about all the great initiatives that are happening for suicide prevention. Do you have any sort of final thoughts for us today, or just something to sort of sum it up and drive home your points from today?
The biggest thing, if I were to sum it up all in one notion, would be the fact that all the avenues are helping the suicide rate. It's not just one thing. We can't pinpoint it to one action or one training. It's all of it combined. Being able to simultaneously go down all these roads, from training to awareness to intervention to mental health concerns to resources in the community, but also the outreach to each and every one of these entities within our community, such as our veteran and military communities, our school communities, our hospital communities, our recreation communities, our gun ownership communities. Everybody is affected by suicide in one way or the other, and so we don't want to miss somebody, dismiss a group that could be affected by suicide. And if we go down all these roads, we can effectively reduce a suicide rate within an organization, reduce the suicide rate within our community, ultimately reduce the suicide rate in our state and our nation. We can make a difference, and it just takes effort day in and day out.
Well said. Well, thank you for all that you're doing, and we hope to have you back. You know, it sounds like there's so much going on, and we just sort of scratched the surface with a lot of the programs. It'd be great to have you join us again to just continue to keep us updated and share some of the awesome programs going on that hopefully can be replicated or rolled out in other states as well.
Absolutely, and I think that's well said for you, because that's what we want to do, is we want to share our successes with the other states. And not only that, but express some of our challenges that we've had. And maybe that's another topic for a later date, is when we look at suicide prevention efforts, what are those challenges? What are those pitfalls that we could fall into when we're trying to reach out to our communities?
Exactly. Well, that'll be it for today, everyone, and thank you for joining us. You can learn more about Rick and all the great work going on in Nevada by clicking on the links that accompany the podcast. Don't forget to subscribe and rate us, and, of course, share with any colleagues or friends you think might be interested. Until next time, this has been the Short Takes on Suicide Prevention podcast.